HIV treatment, that actually taking other medication is hard because you have to balance, you have to take other medication, and it's not comfortable. It's known that the hardest to take one medication, the lower will be the adherence. So those are drugs that are not that popular right now, and they're taken to second and third line. And finally, well, finally not, but we're talking about the integrase inhibitors. It makes a very important revolution with the first protease integrase inhibitors went out in 2006 with raltegravir, sorry. It's our preferred drug, and it's in every guideline, every treatment should have integrase inhibitors. Those are the ones that we know. For example, this is the first generation one, it's not used very much. The second one comes with a booster inhibitor similar to the protease inhibitors. We're not using that. And those are the three that we use more often. The dolutegravir is the one in the guideline we have. We use that more often as well. Dolutegravir is another drug, is very popular. We use because the combination of the pills is comfortable, but it's pretty similar to the dolutegravir. It has some peculiarities, of course, but yeah. And then the last one, cabotegravir. It's a drug. It's a new drug. It's a new integrase inhibitor, and we probably will start to use it. Why? Because it's an injectable drug medication. So it's a drug that you're not taking that every week. You're making an injection, and you should inject yourself in a very, very small needle every 4 weeks to 8 weeks. So imagine the change of taking one injection every 2 months, instead of taking a pill every day. So it's kind of a change we will face in the future for sure. Side effects of this drug are pretty well tolerated overall. You know, the neural tube effects went out with the dolutegravir in the trial that went in Botswana at first, and they put a red flag saying that dolutegravir may lead to neural tube effects among children, which mothers taking this medication where they were pregnant, but finally this side effect not, and now actually the guidelines recommend use dolutegravir for pregnant women. And also the rest of the side effects are not very important. It's important also with TB patients that you can only use dolutegravir if you cannot use it, but you can use dolutegravir if you know that you have to double the dose among patients who are taking TB medication. And now let's think about these CAS inhibitors. Recently, a very nice study talking about a new family of drugs. To be fair, this family of drugs has been discovered like in the early 2000s, but since the drugs were going out, they weren't very popular, and the effect wasn't very good. But it's been developed by this new drug, these new capsid inhibitors. And actually, what was very interesting, trials usually used to, whenever you find a trial where you're taking new drugs, you usually face easy to solve problems. It happened with antibiotics. To release antibiotics or new family of antibiotics, they are tested among